the 1970s, only 10% of women would survive after 5 years of a diagnosis of metastatic breast cancer. But today, because of research and the discovery of new and more effective treatments, this has increased to 25%. Metastatic breast cancer is treatable, but it's not curable. Nearly all breast cancer deaths are due to metastatic breast cancer. And this is because, in part, we don't know what causes cancer cells to spread. Most people who are diagnosed with metastatic breast cancer, about 94% of them, were treated at an earlier stage of breast cancer only to find that it later returned as metastatic disease, some even 20 years later. We don't understand why some breast cancers recur or why it spreads to other parts of the body, or why some women, especially those from specific racial and ethnic backgrounds, have different responses and outcomes. So we need to understand the biology of metastasis to develop better drugs to slow, stop, and prevent it. Metastatic breast cancers are more resistant to the standard therapies that we have today. That's why it's going to take more innovative research and breakthrough discoveries to detect, target, and find the cures for this disease in all populations. Since the 1980s, there have been some significant improvements in treatment and overall breast cancer care. But unfortunately, that improvement has not been equal among all populations. Many still suffer inequities or disparities from breast cancer and its effects, including high death rates. Komen's Disparities Research Program focuses both on the biological cause of health inequities as well as social causes, developing interventions to reduce and eliminate these differences. Focusing on these issues will be critical for making an impact for patients living with metastatic disease to ensure that there are better treatments and access to those treatments for all communities. What it comes down to is devastating numbers. Black and Hispanic Latino women are more likely to be diagnosed with advanced breast cancer than white women, and Black women are about 40% more likely to die of breast cancer than white women. We need to change this story, and we can't do it without supporting research that focuses on how to improve outcomes in all populations living with metastatic disease.